Welcome everyone. If you're just joining us, we will be getting started in just a few minutes. We'll give time for folks to log on. Good evening, everyone, and thank you for joining us tonight. We're going to give folks just a few more minutes to log on to the webinar. Thank you for your patience. Good evening, everyone, and thank you for joining us for the State of Early Care and Education webinar. Today is Wednesday, June 24th, 2020. Before we get started, we'd like to go over some housekeeping items and functionalities for our attendees. We are offering Spanish and Chinese language interpretation for this webinar. Please follow the prompt on the screen to access this feature. I will give people a few moments to get this set up. This webinar is being recorded. All attendees are muted throughout the presentation, and the chat box is disabled. Please submit your questions through the Q&A box, which I will show you how to access. At the bottom of your screen, you will see the chat icon, which has been disabled, and next to it, the Q&A icon. Click on that to access the Q&A box. You can view all questions from all participants on the All Questions tab. You can also ask your own questions by typing it into the question box at the bottom. If you would like to submit your question anonymously, check the small Send Anonymously button at the bottom. If you submit your question anonymously, we will not be able to follow up with you offline if needed. And you can view all of your questions on the My Questions tab on the right. Lastly, at the end of the webinar, you'll be redirected in your web browser to complete a short evaluation. We do appreciate your feedback to help us plan for future webinars. So please take some time for the evaluation. It really is helpful for us. Okay, I would like to now hand you off to our moderator for tonight, Ellen Dektar.
Good evening, everybody. How are you? Before we formally begin, I just wanted to check in and hope that you and your families are all healthy and safe. Most of you are joining us to learn more at the end of a very long workday, and your time and engagement are so appreciated this evening, and we're so grateful for the work that you are doing in the childcare field to manage the complex guidance that's coming from different agencies while providing early care and education support to our county's children and families during this time of many, many changes. So thank you, Rowena, for the introduction, and thank you all for joining us, and welcome to our Childcare and COVID-19 webinar for ECE programs. This follows a similar webinar that we conducted on April 1st, as well as a webinar on financial supports for providers and several county-wide listening sessions that we've had in the past few weeks, in which 187 programs from across our large county participated. These listening sessions were what generated a lot of the priority focus of tonight's program. And we've asked our colleagues and experts at Community Care Licensing and the Alameda County Department of Public Health to address some of your questions here tonight. I would like to extend a special warm welcome on behalf of the following Alameda County partner agencies who compose the Alameda County Child Care Emergency Response Team, which has been meeting daily or twice a day since mid-March to figure out what's going on, how to support you, and how to support our essential worker families. So on that team, we have First 5 Alameda County, which has been instrumental in supporting communications channels like this one during the pandemic, as well as helping us with analysis and program development. The Alameda County Social Services Agency, the Alameda County Office of Education, Superintendent Karen Monroe's staff, the Alameda County Public Health Department, and our anchors across our county and our communities, the 3 child care resource and referral agencies, which are working daily with families and you as child care programs. And these are Bananas in North County, Hively in our Eastern County, and the Community Child Care Council, or 4Cs, of Alameda County in our southern region. My name is Ellen Dektar, and I'm the manager of the Alameda County Early Childhood Education Program. Our program houses the 25-member Early Care and Education Planning Council, consisting of parents, providers, community organizations, and public agencies. And our meetings are welcome to everyone, and there's more information on our website at acgov.org, which you'll see a link to later on. Our program has a policy focus and is a convener and system builder for our roughly 2,000 public and private programs, childcare programs in our county. And our publicly funded childcare system receives about $170 million in state and federal funding. This evening, I will be serving as the moderator. Before we dive into the content this evening, I wanted to provide some context on what will be shared, as well as briefly touch upon the efforts that have been happening locally. Our county partners, who I just described, have been working diligently to analyze, identify, and explore all available options and opportunities related to COVID-19 childcare emergency response. Over the past 3 months, we've seen the rapid fire pace in which policies, procedures, and other regulations have been coming at you and are still continuing to change as we speak. And we know this has led to disruption and uncertainty for the ECE field. This evening, we'd like to share information with you that directly impacts you, childcare providers, and in turn, the children and families you serve. Please note the information being shared this evening is what we know and understand as of today. And as you know, this information is subject to change based on further guidance shared by local, state, or federal authorities. So please keep this in mind throughout tonight's webinar. So the next slide, please. Here's a little on what's going to happen this evening, our agenda. And we will have this call until 8 p.m. Basically, we have 3 core presentations, one around public health, one by our colleagues at the Community Care Licensing Program at the state, and then information from our Alameda County Emergency Child Care Response Team. And we'll close with sharing some resources, key resources for you. At the end of each section, we'll have a brief question and answer section with the panelists using the questions that you have previously submitted upon registration. Should time allow, any questions which were submitted but not answered in a presentation, we'll try to get to. And for those we can't get to, we will be generating a frequently asked questions document, and we'll make that available after the webinar. So now that all that is out of the way, I'd like to introduce our first panelist, Lisa Erickson with the Alameda County Department of Public Health. We're going to give you a little bit of background on each of our speakers just to help you understand the perspective we're bringing to our work. But across all of our perspectives, I'd say we deeply appreciate what you're doing. So Lisa has had over 19 years of experience working to support children and families through direct service, as well as program administration and policy development. For most of those years, Lisa worked at First 5 Alameda County, where she developed and managed a comprehensive blend of programs and managed First 5 Alameda's place-based and school readiness initiatives. Currently, Lisa serves as the Family Partnership and Elementary School Coordinator for the Center for Healthy Schools and Communities at the Alameda County Healthcare Services Agency, where she supports integrating and coordinating effective family partnership strategies in schools and communities. And I will just share that Lisa started right about as this pandemic broke, and now she is our COVID childcare expert, and we're really happy to have her. And Lisa, take it away.
Thanks, Ellen. Yeah, so I started in a different job, but as you'll see on the slide, I'm now the school and childcare liaison. So I think I've been working with many of you who are on this webinar and answering questions and really learning a lot, like everybody. Thanks, Ellen. So go on to the topic slide, the next slide. So this is what I'm going to cover today. There's a lot, it's a long list. So it's going to be sort of high level, but I am going to point out some really important resources that were just posted to our website this evening. So you'll be able to kind of dive in and read about more of the details on all of these topics here. Next slide. So before we get into the specifics of childcare, I wanted to just talk a little bit about our data. So this is our county, our Alameda County COVID-19 dashboard. It's very easy to find on our website. Some things aren't easy to find on our website, but this one is actually, you can find it. So it's right on the front page, and it's updated daily. And so I just wanted to give you a quick snapshot. Right now we're up to 5,140 cases. It looks like when I posted this, anyway, it's already been updated on my slide. So, and 120 deaths. And for the age groups that are mostly impacted, it's between the age groups for cases between 18 and 40. That's 44% of the cases are for ages 18 and 40. But for the deaths, 70% of the deaths are for 71 and over 81. So between those ages. And of that group, 30% of those are 71 to 80 age, and 70% are 81 and over. Also, the highest percentage of cases are in Oakland with 39% and 17% in Hayward. And right now we have 78 people hospitalized and 30 in the ICU. So that's just a quick snapshot. So next slide. And this is our, what we call our county reopening plan. And as you can see, it kind of leads you through the phases of reopening. Right now, we're in that second yellow arrow right there, where we're opening outdoor museums, outdoor fitness, summer school. So that's where we are right now. Usually it moves at about 2 to 4 week intervals. And the way this works is that we have to be doing well on our 5 indicators, and then we have to work with the State Department of Public Health to make sure that we're able to move forward. So we kind of work with the state in order to implement our reopening plan. Next slide. And these are the indicators that I just mentioned. So there's 5 of them. And you can see the little bars here where we're doing really well. You can see all 5 of the boxes. Where we need a little more work, there's only 3 boxes there. So in the first one, which is cases and hospitalizations, our cases have been rising over the last 7 days, but our hospitalization rate is flat. So that's why we're at 3. For this, we have sufficient hospital capacity, so we're good there. And the testing capacity, we're doing pretty well as well. Our goal is to reach 3,100 tests per day. We're at about 2,500. And our sufficient, and we're doing pretty well with disease containment. Not quite there, but we're trying to hire more contact tracing staff. These are the staff that go out and help us with investigations when there is a positive COVID-19 case. So our goal is to meet 300 contact tracing staff. We're at about 90 right now. And then our last indicator is sufficient protective PPE. What does that even stand for? Gosh, I'm so used to saying PPE. Protective equipment, personal protective equipment, thank you. And so our goal there is to have 0 requests from our healthcare providers for PPE. And that has not happened. We still have about 41, I think in the last 2 weeks, we had a 41 requests for PPE in the county. So these are our indicators. This is what we look at in order to kind of move forward with opening our communities and our businesses. All right, next slide. All right, so there's lots of confusion around what happens at the state level and what happens at the county level. So I thought I'd try to clarify this a little bit. I'm sure there will still be confusion, but because I know there's confusion among us working at the local level around this sometimes. But wanted to let you know that there's 2 separate health orders. One is issued by the governor, and that's the state shelter-in-place order. And the other order is issued by our Alameda County Health Officer, Dr. Erickson, and that's our local health order. Both of these orders are in effect in Alameda County, but when there's a conflict between the 2 of them, the most restrictive order is what prevails. So let me give you an example of that. So let's say that the state says you have to have a group size for your childcare of 10. And then let's say that the county says that you have to have a group size of 12. In that case, you would have to go with the state, which is 10, because it's more restrictive. So that's how these orders kind of play together. Sometimes there's not the greatest communication between the state and the county, so it can confuse a lot of folks, which is what happened last week when that mask order came out from the governor, which I'll talk about later. All right, next slide. So now I'm going to kind of get into the different strategies and practices that we're recommending to keep your childcare, to keep the children and staff safe in your childcare. These are also the strategies and practices that allow us to reopen, right? Because it's a big deal. A lot of anxiety, a lot of just, a lot of feelings about reopening right now during this pandemic. So this is what we're doing. So the first, probably most important strategy is this concept of stable bubbles. And so what we're recommending is that children there's 12 or fewer children in a group, and the smaller, the better in that group. But 12 is the maximum number for a stable cohort. And if there's more than one group of children cared for at one facility, each group should be in a separate room if possible. And lastly, childcare providers should also remain solely with that one group of children. So we don't want childcare providers moving from one stable bubble to another stable bubble. They should really remain in that bubble. The reason why this is important is that it limits the commingling of various households through creating these bubbles. The idea is as we slowly move out of our families and our household into the community, we want to make sure that children and staff are safe. So we're kind of cutting down on the transmission that can happen when there's lots of different households commingling together. It also makes it easier for contact tracing. So when there is a positive case, public health is able to trace where that case might have come from and where are the close contacts. If the positive case is exposed to many different children and staff in that childcare program, not only will you maybe have to close the entire childcare program when there's a positive case, but it's also harder to trace. It's harder for us to do contact tracing. So this is a big concept that you're going to hear a lot about over the coming months of social bubbles, and I call that here stable bubbles in childcare. Oh, and actually, before I move on to the next slide, I wanted to just clarify a couple of questions that I continue to get. One is, can families in my childcare be in two different childcare programs at the same time? Maybe they do family childcare for a couple days part-time, and then maybe they're going to a childcare center. This is not allowed. They need to only be in one extracurricular type activity, which could be childcare or a sport or some sort of activity, but only one. It can only be one, in addition to a social bubble. They're also allowed to be in a social bubble and then one extracurricular activity. In this case, it would be just childcare and just one of those. So I hope that's clear. Another question I get a lot is, we say here that providers should remain solely with one group of children, which is true, but sometimes there's directors, that childcare provider that may need to alleviate staff and relieve staff, and so that's permitted. Directors are allowed to do that. They can go they can be a floater, for example. Substitutes is another question. You are allowed to have substitutes. Ideally, you would have the same substitute for your program, so not using lots of different substitutes. And to make sure that when you have floaters and substitutes in your program, that you are making sure they're wearing face coverings and trying to physical distance if they can. Yeah, okay, one other question I wanted to touch on is partitions. We say here that they need to be in separate rooms. The groups need to be in separate rooms. You are able to use furniture, bookcases, let's see, what else could you, room dividers to create separate rooms if you need to. Also in very large spaces, you can use 10 to 12 feet buffer zones to create spaces as well. Also wanted to point out, it's best to have windows open, lots of ventilation. All of the ventilation and having good air circulation will help with transmission as well in your program. So lots of questions around the stable cohorts. I hope I answered some of them. On to the next question, or next slide. So face coverings, another big topic that I get a lot of questions about, and there's lots of confusion around face coverings. So the state last week put out an order that everybody over the age of 2 statewide needs to be wearing face coverings while they're in public places. Wanted to point this out because there was some confusion about, does that mean in childcare? What does that mean for childcare? What does that mean for camps? So go ahead and move to the next slide. And this is where I clarify what Alameda County Health Department says. So the state said that for schools and childcare, you can look to the local guidance. So you don't have to worry about requiring your kids to have face masks or face coverings in your care. So continue to look at our guidance for this around face coverings. And our guidance right now is that staff is required to wear face coverings. Children in childcare are strongly encouraged to wear face coverings unless they cannot tolerate wearing one. And then lastly, never place face coverings on babies or children under 2 because of suffocation. And one thing I just wanted to say about face coverings is that we know that it's hard. I'm getting lots of questions. There's lots of families that don't want to wear face coverings and just lots of anxiety and kind of confusion around face coverings, but we really are trying to kind of move the norm, right? We have to kind of all be in this together. And this is one way of face coverings. It's allowing us to kind of reopen, to re-enter communities and to, get back to normal as much as we can, is through the use of face coverings. So it's a very important strategy for us. It's going to take a while probably for them to get used to wearing them. We also are kind of seeing this as a school readiness opportunity because in schools, they are going to be having to wear face coverings. And so let's get them used to that, the idea of face coverings. All right, on to the next slide. And physical distancing, I don't need to talk a whole lot about this one. Everyone knows, I think at this point, what physical distancing means. It's the 6 feet that everyone hears about. And that's ideal to prevent the spread of COVID-19. I did want to mention that it's not really a magic number. It's, the more distance, the better is the way this works. And then on to the next slide. And the reason why I'm bringing this up is because I get lots of questions about physical distancing in childcare. How do we get little kids to physical distance? Well, we can't really. It's very, very difficult. And it's not really kind of how we want to run our childcare programs as well. So that's why we have this stable bubble. That's why it's very important to keep these bubbles together, the cohort together, to prevent that spread of the virus, because kids are going to have a hard time with physical distancing from each other. So the face coverings and the stable bubble is really how we're kind of helping with that, that spread of the virus when physical distancing isn't possible. Next slide. Okay, another hot topic that I'm getting lots of questions about, health screening. I'm not going to go through all the details of a health screening because it's fairly detailed, but I did want to point out that we have a new guidance on our website, and all of the links to these to our websites are on the resource slide at the end of the webinar, as well as on my second to last slide as well. But for screenings, we're recommending or requiring that all children and staff are screened daily for COVID-19 symptoms. And there's 3 steps to a screening. The first step, which is very important, is to ask about the COVID-19 symptoms. And how you do that is in that screening tool that I just mentioned. So I'm not going to go into all the details of how you do it, but that's the first step, is to ask about the symptoms. And then a visual check. We also make some recommendations about how you do a visual check in that tool. And then lastly, the temperature check. So we also want to, call out that it's okay if parents take the temperature check at home. You don't have to do that at your program. It can be very, time consuming and difficult, and oftentimes thermometers are hard to come by, especially the touchless thermometers for the temperature checks. And we also have more information on our website about how you would do a temperature check, and it's actually on the next slide as well. Sorry, my dog is barking. Sorry, hold on, let me mute really quick. Okay, sorry, I'm back. We put the dog outside. So this is how to safely take a temperature. There's two ways to take the temperature. First is with is wearing PPE, and to make sure you have a face mask, eye protection like goggles or a disposable shield, and that you use a single pair of disposable gloves. And the second way is to use a physical barrier, which this I know is more difficult in childcare, is to have kind of a plastic partition or perhaps a window behind you while you're taking the temperature. And again, there's more information on taking temperatures on those resources. I didn't want to go through every single detail, but just wanted to point out those two ways of taking the temperatures. And then also that we do have a nursing consultation program. In our last webinar, we talked about that. And I do think this is something that the nurses have been working with programs about and helping them kind of establishing procedures for taking temperatures and all the health screenings. Thanks. Next slide. All right, so what to do when a child gets sick in your program. So if a child becomes ill during the day with a fever of over 100 degrees or higher, a dry cough, fatigue, extreme fussiness, or shortness of breath, you want to be sure you have a room to isolate them. And you notify their family right away to pick them up. And you also may apply a mask over the staff and children who are over 2 years old. And then always be sure that the child is supervised, obviously. So that's what to do when a child is sick. If you go on to the next slide. This is what happens when after the child is sick. There's many different scenarios. This is going to be a little tedious. I'm just giving you a heads up because I'm going to walk through 4 different scenarios about when it is safe for a child to return to care. And again, this information is in that tool that I keep mentioning around health screening. So the first scenario is if a child is tested and the COVID-19 test is positive, the child may return after, and they have to meet all 3 of these criteria. At least 10 days have passed since the symptoms first appeared, and there have been at least 3 consecutive days with no fever without taking medicines to lower the fever. And lastly, and this was something that just changed on the CDC from CDC, was that for respiratory symptoms, if they were present, they have to have been improving for at least 3 consecutive days. So they would have to be without cough or shortness of breath for at least 3 consecutive days. So these are the 3 criteria if there was a child that tested positive for them to return to your program. On to the next slide. So this scenario is if a child is not tested and has no medical evaluation, but they had a fever, they're sick. So we're just going to assume in this situation that they have COVID, right? They're going to stay home in the same way that someone with a COVID positive test would. So they have to meet the same 3 criteria. The 10 days have passed, the 3 consecutive days with no fever, and their respiratory symptoms need to have been improving for at least 3 consecutive days. Okay, on to the next slide. Oops. All right, so this one, if the child is not tested, but has a medical evaluation that they may return before, they can return before 10 days have passed if the symptoms have resolved and the medical evaluator, like a doctor or nurse practitioner, has given them an alternative diagnosis. And to make sure that the symptoms, were not due to COVID. And so for privacy reasons, they don't have to share what that diagnosis was, but they can come back before 10 days if the symptoms have resolved and they have a doctor's note. You are all providers and know that there's lots of different things that kids get, hand, foot, and mouth disease, all kinds of different sicknesses that they can get. And so those are the kind of things that they'll need doctor's notes for in order to come back to your care. And next slide. So this is when a child has a negative COVID-19 test. They can return after the child is feeling better. The symptoms do not have to be completely resolved, but they have to have had the no fever for 3 consecutive days without the medicine. All right, so hopefully that clarified some of those questions that you all have had about when a sick child can come back to care. I know there's lots of different nuances, and you're free to call me or email me with any of the nuanced questions. We're also continuing to develop more guidance out of public health that will hopefully help clarify some of the confusion around all of this. Next slide. So another question that I get asked a lot is what happens when there is a confirmed case in my childcare program? So this is the process in short, which there's a new email that you can email and phone number to call when you have a positive case. And it's right here, it's COVID Workplace at acgov.org, and there's the phone number. And what will happen when you email or call this number is that the public health department will work with childcare, to help identify the next steps. They may also work with you to help identify the adults and the children that may have had close contact with that positive case. And they will also help you with communication around if you need to communicate with your community, if maybe you need to close. They'll help you with all of those next steps. Hopefully we can come up with some scenarios around this as well, because I get lots of different nuanced questions around, you know, what happens if we're waiting for a test? What do I do then? I'll give you an example so I can answer that question right now. So while your staff or a child is waiting for a test, they need to quarantine, but you don't necessarily need to close your classroom or school down when that happens. So all those kinds of questions, I think we're going to be coming out with another kind of tip sheet or FAQ, frequently asked question around those different kinds of scenarios. But in the meantime, please, you know, call this number or this email when you have a positive test, and you're also welcome to call me as well if you have questions. Let's see, next slide. Oh, and I just wanted to define what is close contact? What does that mean? So this is how public health defines close contact. It's if the person, if adults or children who may have had contact within 6 feet of that ill individual for more than 15 minutes during the time period between the 2 days prior to when the individual's symptoms appeared and the last time the child or staff attended the child care facility. So that's how they'll kind of think about close contact. It's the within 6 feet for over 15 minutes. Thanks. Okay, on to the next slide. Okay, this is my last slide. So this is a very important web page that I put here. I just put the link at the bottom. This is what our web page looks like. This is the one web page on our public health department that has all of the childcare resources that you may need. And there's the link right there. So I would recommend that you put this, you know, save this as a favorite in your browser. We're hopefully going to be updating this frequently with new resources. So yeah, please make note of this. So and like I mentioned, we have some new resources on there tonight that you can access. And I think that's it for me. And then this is just our regular Alameda County Public Health website. And thank you so much. And thank you for all the work that you all are doing. I'm here to help. If you have questions, feel free to call or email me anytime. I think I've definitely talked to many of you. So thanks again.
Hi, everybody. Thanks. You can hear me again, right? Or when I was trying to shut me up. Thank you so much, Lisa. I think we're probably going to move along down our agenda, but I just wanted to say we got a lot of questions around what do we do if there's a positive case? And I just want to underscore you have a slide on that with some detailed instructions. And can you just, you know, break it down again? How do you care for infants and young children by social distancing? Is that necessary? Oh, no, Lisa, maybe it's muted. So If she can't be unmuted, I'll just say what I think I heard you say is the idea of the social bubble and having a bubble in the childcare is meant to kind of minimize that need. You can't hold an infant 6 feet away. They have to be cared for. You got it. Okay, I'm learning, everybody. Okay, so next we're gonna welcome our guests from Community Care Licensing. We're so grateful you could join us. We have Chandra Charles, who has been the licensing program manager of the Oakland South Childcare Office. And she's been with the department over 5 years. And prior to that, she held other positions with the state. We're welcoming Anneka Evans, who's the regional manager of the Oakland South Childcare Office, which covers territories in Santa Clara, Alameda, and Contra Costa counties. And we have a colleague from the Fresno area, Rebecca Varela, who's the regional manager of the Fresno office with about 18 prior years with community care licensing. And we really are appreciative of having you here tonight. And we've asked you to address 4 key areas that have been raised by our providers on listening sessions. So I'll hand it off to you all. So Anneka, would you like to start?
There we go. Hello, everybody.
Hello. You made it.
I did. I made it. As she stated, my name is Anneka Evans. I am the regional office manager of the Oakland Southeast Child Care Office. Many of you know we started out with one Oakland office and then we were split into 2. The original Oakland office only covered Contra Costa and Alameda counties. We were blessed to be added to cover parts of Santa Clara County. So we're 2 offices in one location. We are still currently at 1515 Clay Street, Suite 1102 in Oakland, California. It's funny because a lot of what Lisa said is what I was going to cover. So what she said, basically what she said in dealing with social distancing, dealing with face coverings, mask coverings and things. But there were 4 areas and 4 questions that we received that we wanted to address. The first question was, how many children can we have given the new guidance? And this is just what Lisa was saying, whichever order, whether that's the state order, so that's licensing, or the county order, whichever one is more stringent, whichever one is more strict, that's the one that you want to follow by. And I know it gets a little confusing, and I should probably start by saying, just reminding you all that everything that's evolving around COVID-19 is very fluid. And what I want to relay to all of you as providers is understand that community care licensing is here to work with you. We have the thing that we're doing called televisits. And understand these are not punitive visits. These are not, a lot of people had a lot of uneasiness and a lot of anxiety around these visits. These visits are really just to ensure you have all that you need, you have the proper postings up. We are here to work with you. We are here to help you. And we're in this together. As I am so grateful that we have this collaboration with all the different entities, early childhood education with County Department of Public Health, licensing, your resource and referral agencies. We are all trying to work together so that we're giving out the exact same message. We're trying to work together so that everybody is getting the same message statewide. I know there are a lot of different provider networks and that get together and, well, they told me this and they told me that. And then you call the office and this analyst told me this and this analyst told me that. And you call our complaint receiving unit, they give you something else. We are all trying to work together to get you the most up-to-date information as best as we can. So please be patient with us and understand we are here to help you. Do not, okay. Thank you, Michelle. The Alameda group size maximum is 12. That is the licensing, that is the Alameda County maximum group size is 12. So understand that, but I am going to get into that just a little bit more. I do have my colleague here, Rebecca, as well as Ms. Chandra Charles. Chandra are the boots on the ground, so to speak. Rebecca and I are, but Chandra actually works with the analyst more hand in hand. So Chandra, if you need to jump in, just please unmute Chandra and Rebecca to be able so that they can jump in. The question again was how many children can we have given the new guidance? The Alameda County is 12. Licensing is on board with the 12. Children should remain in groups as small as possible. Should these guidelines differ from your local health ordinances, follow the stricter guidance. It is important to keep the same children and teacher or staff with each group and include children from the same family in the same groups to the greatest extent possible. I know that this is difficult, but that's why we have so many questions. If children are coming from the same household, we want to kind of keep them together. You can always contact your local licensing office and request a waiver so that we can do the co-mingling thing. It's very lenient right now. And again, we are not doing any punitive visits. We are not citing anybody. We're here to help you. We're here to work with you so that we can all be on the same day. And okay, Rowena's having challenges unmuting people. Okay, that's good. Chandra, you know, you guys can text me on my work phone if you guys want to add something in there. The second question was 12 with teachers or 12 without, or 10. According to Penn 20-06, if you look at pages 2 and 3, all child care centers should adhere to the following teacher-child ratios and group size outlined for the prevention of containment. Okay, Chandra and Rebecca are unmuted. Thank you. Okay, outlined. So the pen is 20-6. Looking on page 2 and 3, and I'm hoping everybody has access to our pens. PIN stands for Provider Information Notice, and they are updated. They are on our website. You look under Childcare, you have access to those. If not, you can contact your resource and referral agency. They usually have those. You can contact our advocate, and the advocate for the North is Tawny Grossman. And I'll be able to give you guys that information as we wrap up the presentation. So follow the group size in the charts on that pen, unless a more restrictive group size or is required by the federal, state, or local authorities. Note that the group sizes do not include the teacher. When mixed ages are present and including an infant under 18 months, adherence to the 1-to-6 ratio must be followed to allow the responsive caregiving. If all children being cared for are infants, adherence to the 1-to-4 ratio must be followed within a group size with no group no larger than 10. For a family child care home, small and large family child care homes, okay, let's see, question, okay, I'll go back over that. Small and large family child care homes may serve a total capacity of no more than 14, but because Alameda County is 12, we're gonna say no more than 12, and group size may not exceed 10 children. So I don't want you to be confused about that. If you have up to 12 children, you cannot have more than 10 children in one group. Does that make sense? For
Yes.
Alameda County, you
And
can have
also,
up to 12 children. Go ahead.
Anneka, I think it's
Yeah.
also important to remind them that we're talking group size, not ratio. Ratio
Exactly.
is still the same. So if you have 12 children in a family child care home, you will be expected to have 2 staff to
Absolutely.
provide parent supervision. And it's the same as in a center. If you have over 12 children, we're dealing, it gets complicated because we're dealing with both group sizes and ratios. Ratios are still the same. And once again, we do want to maintain the smallest group size possible, but we are, for the most part at this point, talking about group sizes versus ratios.
Absolutely. Thank you, Rebecca. So please understand that the ratios are still the same, but we're talking about the sizes where the county allots for 10 children, 12 children, sorry, Alameda County, 12 children, you still cannot have more than 10 children in one particular group, And if you can break those groups down even more, that's all the better. That's all the better. In other words, if there are more than 10 children in care, then the children need to be divided to the small groups and kept separate from other group of children each day to the greatest extent possible. So when Lisa was talking about the director becoming a floater and you having all of these other teachers that are coming in, giving breaks and things like that, as much as you can minimize that where there are different adults dealing with different groups, try to do that. But I know people need to use the restroom, they need their lunch break and things like that, but please maintain that social distancing, if we can say that, as much as you can. So again, as Rebecca was saying, reminding you, ratios and the group size is something completely different. So I hope that that's clear for everybody and that didn't confuse anybody anymore. The third important thing that we had an overwhelming question was, if we're keeping them in small groups but sharing the same space, how separated do they need to be? Can they be outside at the same time in separate sections of the playground? So there's guidance. If you go to the website, www.covid19, no dash, just covid19.ca.gov. And you can click on there, and then there's guidance where it specifically has guidance for childcare, and it's in a PDF form. So that would give you a little bit more explanation on that. Arrange developmentally appropriate activities for smaller groups, activities, and rearrange furniture and play space to maintain 6 feet of separation when possible. Understand, when possible. Yes, they can be outside together, but we do, okay, thank you, Rowena. We want to make sure that they are separated as much as possible. So the key to all of that is, as much as you can, break them down into smaller groups, because then you can kind of maintain those activities without kids running all across the yard. For napping, place mats, cribs, and cots 6 feet apart with heads in the opposite direction. So if you don't have that 6 feet apart within the room, please do that, head to toe, and try to get as much space as you can around them. Put them around bookcases and things like that. But please be where you can always see and monitor them. Don't leave them in a closet. Don't put them in a closet. It's somewhere where you can't get to them. Use opportunities to reduce time and spend indoors by bringing children outside, weather permitting, while maintaining physical distancing. So as Lisa was saying, make sure that if you're inside, you have a constant flow of fresh air. Open the windows if weathers are permitting. Open the doors so fresh air can come in, as it is going to be very difficult with smaller children opposed to school-age children, keeping them distant from each other. So just try to do it as much as you can. Offer more opportunities for individual play if you have the staff. Plan activities that do not require close physical contact between multiple children. Stagger indoor and outdoor play and adjust schedules to reduce the number of children in the same area. Ensure all outdoor play equipment is cleaned and disinfected between use by different groups of children. Develop spacing, instructions, in both indoor and outdoor space that are developmentally appropriate and easy for children to understand. And we just have 2 more really quick questions. How would you renew CPR in first aid? The same practice in the past, however, the in-person classes have been significantly reduced to allow students to be 6 feet apart at all times. Students are required to wear a face covering or mask during the training. On our side, so this is in Alameda County, providers are utilizing Adams Safety Training. They are located in San Ramon, Emeryville, and San Jose. One thing to keep in mind when choosing a training center is to ensure that they are EMSA approved. There may be others out there, but we know for a fact that Adams Safety is available, and they are scheduling CPR and first aid. And those are the areas that we are familiar with, San Ramon, Emeryville, and San Jose. And our 5th and final question was, is it true there is a 120-day grace period? For new applications, the department may issue a provisional license for otherwise qualified applicants who are not currently certified in first aid and CPR as outlined in section 1596.84 of the Health and Safety Code. The provisional license shall expire 90 days after the date of issuance. For those who are renewing, register and submit proof of enrollment to their assigned analyst. So again, I just wanted to remind you that the visits that we are doing, the tele-inspections, are not punitive. We are doing tele-inspections for pre-licensings, for change of locations when the fire department are doing those inspections. And pre-licensings, we're not doing our annual visits. So pre-licensings and change of locations and the pop-ups. Yes, the pop-ups. And so yeah, so the coronavirus health emergency is a fluid situation. I wanted to remind you guys about that. And it's rapidly changing. The information and the guidances, we're trying to update them as quickly as we get them. Please stay on top of your PINs, those provider information networks. Contact our local office. That phone number is area code 510-622-2602. 510-622-2602. That's the same number for the Oakland Regional Office and the Oakland South Regional Office. You can always ask for the analyst that is on duty or the desk duty officer. We have at least 2 officers of the day available. I always make myself and my information available to you. You see my name. It's Anneka.Evans@dss.ca.gov. Give me at least 24 hours to respond to your email. Email is the very best way to get an answer from me. I usually have my phone and my email with me, and I try to get back to you within the hour of when I receive them. So Rebecca, Chandra, is there anything you guys wanted to add that maybe I didn't cover?
No, you did an excellent job on covering it. You took my spot. So
I was trying to hurry through it, but we just want to thank you all for having us on here. We hope that the information was very informative and helpful, and we are really partnering with all of the entities that are on this call tonight. And as I stated at the beginning of it, the department, the Alameda County Department of Public Health, what she said. She took everything that I was going to say. So
you took everything I was going to say.
See, we're
That's
all
good.
working together, and that's a good
Appreciate
thing.
it. Yeah,
So,
no, that's
Ellen,
great.
thank you so much for having us.
There was just one question about group size, and it would just really depend on the county. I think we're trying to limit the group size to 10, but
Right.
Certain counties are allowing 12.
So ours is 12, and I wondered if Lisa could just kind of underscore that for us.
Yeah.
Yes, our group size is 12. But I do want to clarify one thing about group size. There was a little bit of confusion in one of our orders, the way they wrote it. They said something about that the group size would include staff. That's not true. It's
No, it
12 children. Yeah, right. But it was very confusing. They wrote it and I was like, why did the lawyers write it that way? It's really 12 children And then you can have as many staff as you need, at least from the public health perspective. So you could have a total of 14 people in that cohort, 12 being kids, 2 being adults, just as an example.
Yeah.
So, yeah, so I wanted to clarify that.
What she said.
Okay. Great. Thank you so much. Any last thing, Lisa, and then we're going to move along to our county.
Yeah, one quick thing.
Okay.
For the Berkeley childcare providers, you need to contact the Berkeley Health Department. I just wanted to remind you that. And Ann Song is the person that you need to contact there. Just wanted to call that out because they're similar to Alameda County, and we usually try to align, but it's just better, in case there's nuances, you should contact them.
Fantastic.
Lisa. Thank you, Ellen,
Thank
so
you.
much.
Thank you so much, everyone. All right, now we're going to move along to our county team. I'm going to introduce you to Jennifer Caban, who is a management analyst with the Alameda County Social Services Agency, where she supports ECE and child welfare policy and contracts. She's an early childhood advocate who brings a strong blend of cross-sector experience amassed over 25 years of dedicated service to creating access and equity for education. She's going to be joined by Kim Johnson, who is the Executive Director of Bananas, which is the Childcare Resource and Referral Agency serving North County cities, and Angela Cabrera, who I have the pleasure of working with every day on the County ECE team. She is our quality improvement navigator and has helped shape statewide leading work around dual language learners and has a lot of experience working directly in ECE and as an inclusion specialist and resource and referral program manager. So I'm proud to work with these folks, and Jennifer, please take it away.
Thank you so very much. Greatly appreciated. Just first and foremost, it's just an honor and privilege to be with you all tonight. I know that you could be doing something else and getting some rest. So I appreciate you sacrificing some of your time to be here. Again, my name is Jennifer Caban with Alameda County Social Services, a member of the team. I'll be providing a general update on the work that we've been doing, and my colleagues will join to showcase some of the concerted efforts of the Alameda County Emergency Child Care Response Team. The agencies who are participating, there's a long list. You can see their logos on the bottom. I won't bore you with all our long names. Ellen mentioned them on the beginning of this call. So our logo's there. And next slide, please. Okay, so many of you may have wondered, what has the response team been doing? What has been their focus areas? So this slide is just showcasing, really there are 3 main areas that we have focused our work on since March, when all of this hit our county. The first and foremost is childcare access and support. What this focuses on is includes connecting families to care and identifying open sites and supports to the field. Those supports look like supplies and mental health. Additionally, we've been working on coordinating information sharing and communications. We know that there's so much out there. There's plenty of websites, plenty of policies and regulations. So we've been working as a group to review and analyze those policies and regulations, which are varying by local and state departments, aligning our communication across agencies. So as we're reaching out to you through R&R agencies or First 5, trying to align our verbiage as much as possible to share this updated information. And we've also worked on a data dashboard. So that little image that has really small text is just a glimpse of what that looks like. You can find it on the AC.gov ECE website. And again, I know there's a lot of questions kind of coming up on where this information is going to be provided. This webinar is recorded, so you'll have access to that. And there will be resources that are shared afterwards. So just to ease yourself a little bit more. Finally, policy planning and funding. Again, we did a lot of advocacy around funding in the very beginning and still to this point, both locally and statewide. and really have been working with our agencies to better inform the decisions that are being made that are impacting the field. Okay, so next slide. All right, so there's a lot of text on here. This is just a really high level overview of the work that has been happening within the group over the past several months. What's listed here is not exclusive to just one particular month. They've been overlapping from month to month, but this is just to give you some highlights. In early March, our immediate focus, what we did hit the ground running, was really assessing the ECE field, how this was going to impact childcare and access to childcare, identifying the open facilities, and how do we even connect essential workers to childcare? That was really important to us and what we focused on. Some key items that came out of that is the development of a tiered response system. So many of you might remember there were pop-up and employer-based childcare sites, and then we had all our licensed childcare facilities and what was what. So we developed a tiered system around that. We also created a map of where our hospitals were adjacent to childcare programs, and we also did some technical assistance supports to those pop-ups that were developed. We developed a centralized intake form, so families weren't sure how they were going to be routed. We worked with hospitals, sharing information, and centralized the location where our parents would access care and connected them to the local resource and referral agencies. Again, Ellen mentioned on the beginning of the call, we had daily calls 2 times a day, in the morning and in the evening, just to do that monitoring. We had a survey that went out to providers just to see who was open and still accepting kids or children, because we had no idea what was happening. And we also, again, connected with local and state stakeholders to just uplift the need for funding. We knew how this was going to change a great deal, and so we worked tirelessly to make that happen. In April, we started seeing the rapid pace of policies and directives, and again, most of the questions that I hear from the field that get routed in some way, shape, or form have to do with the policies and regulations, because there's a lot. They don't always align, so we were just trying to compile those. That led us to do some webinars very early on. We did 3 really key webinars that happened for, similar to this one, State of the ECE in Alameda County. We did one on small businesses to help providers get connected to PPP loans and the such. And there was one on mental health support that was held. Additionally, in April, with all the information that we were getting through the universal intake and just the survey of providers, we developed a supply and demand dashboard. And that gave us a central place to analyze data and also share that and uplift that with local elected officials and agencies around that work. Once the funding came down from the state, so our county received just over $2 million for childcare vouchers, and later received about $4 million within the county to fund supplies for childcare. Our team really worked effectively to have conversations of what that would look like and how that should be communicated out to the field. And again, nothing is perfect, but there was a lot of effort of like, how do we get this out in the fastest way possible with all the uncertainty in this world. Okay, in May, once we got a little bit of a rhythm of like, okay, now we're connecting families to care. Now we have funding. There's actual tangible funding that we know that we can connect to families. We wanted to get some additional supports out there. We were able to concretize local funding, and I'm happy to report through the advocacy of the team. Alameda County, particularly Social Services Agency, provided about $750,000 additionally to the $2 million for childcare vouchers. That was made possible through the work of the response team, and the R&Rs were able to work on the supplies and stipends distribution, which was a whole lot to handle. My fabulous colleague, Kim, will discuss a little bit more about that in depth in just a few minutes. And so that was most of May. And now currently where we are is with implementing mental health support consultations. We've also been really committed to hearing from the field in general, and particularly from the providers. So you who are on this call today, to get a better sense of what your challenges are in the field and just how we can better support. Just to give you a little background, I'm going to jump back to the mental health support. That became kind of like a subgroup and a partnership amongst a number of agencies. It included the response team, but also leverage relationships with mental health agencies, including Alameda County Behavioral Health Services, Jewish Family and Community Partnership, and Hively, who now has a family counseling department. The aim of that particular program was to mobilize mental health consultation services for systemic and strategic, it's late, response for the childcare providers during COVID-19. Those applications really began in May and ran through June, and they were targeting the open sites, so the sites who had identified themselves to R&R agencies and through our survey early on that they were open to receive kids. We currently do have some capacity to support programs as they're opening, because we know that there are more child care providers who are opening their sites to receive children. The link to apply will be in the ECE program resource page, so there'll be a snapshot view towards the end of this presentation. But again, we will send out to you the resources so that they're easily available to you. Just this month, we had 3 listening sessions, and we had this webinar. The webinars that we've had in total, we've touched almost about 1,000 providers through the various platforms that we've actually used. And when I tabulated that number, I was actually pretty surprised that's the impact that we've had in just a few months. So I'm happy to report that. Currently, our team is really thinking about like what happens next. We know this fiscal year there's a lot to change. We know there's still regulations, as the Department of Public Health and CCL have mentioned. Things have been very fluid and moving very fast. So one of the key things to note, we've been monitoring the state budget. There's been some agreements. It's not yet final, but I want to highlight some things for you that are upcoming in the next fiscal year, potentially. So some of the agreements, I'm happy to report so far there's an agreement that they've rejected that 10% cut to rates across the board. That is, yes, is a moment, and I was really excited to see that, because that could have even further devastated the state of the field. They have agreed upon an additional 5,600 new slots, and they're supposed to be ongoing. They've also approved stipends to providers and a hold harmless clause. We don't know how that's going to trickle down or how that's going to be finalized at the end of the day, but I wanted to give you a sense of some things that our legislature has come to an agreement to, and we're hoping will pass. In this next month coming up, we're really just going to focus on sustaining and supporting as best as possible. So there's going to be some technical assistance. We'll continue to share information as much as possible. We really heard you all when you said in the listening sessions, working to centralize information. So that is happening, and coordinating resources when possible. Lots more, but I won't bore you with that. Next slide, please. So one of the main things that have come out of this is just really what the landscape looks like and who is accessing care. This information is updated on a weekly basis. Again, you can find that on the ECE program's website, and again, will be made available through the resources that are shared with you afterwards. I will keep this brief. So what is important to note is that we have had basically over 2,000 children who are currently receiving subsidies. 30% of those are really focused on the COVID-19. Those are new enrollments. Those are essential workers that just came about and are accessing subsidies. What's worth noting is that 70% that are utilizing the subsidies, they were receiving it before. This was pre-COVID. And so that means that those who were receiving subsidies are essential workers. Of significance is really that 70% of the children of these subsidies are Black and Latino families. You know, I want to make sure to uplift that. And the last key thing that I really want to highlight is that, you know, based on Alameda County, the entire centers and FCCs and FFNs that are here, we have, it is just about 44% of our family child care and 30% of centers who are open and receiving care. This, if you've ever analyzed any subsidy, this is not really the reflection of how our subsidies are reflected, are utilized, right? So it's important to note that our family child care centers have really stepped up to support our children and our families in this place. If you want more about the demographics, employment sectors and the such, again, that can be found on that weekly dashboard. These numbers are reflective of just this week. Okay, next slide. All right, so we're gonna go a little bit over the supplies for providers, and I am gonna kick it off to my one of my favorite colleagues, it's Kim with a Y, not with an I, to talk a little bit about the work. My Kim is muted.
Thank you. Wouldn't let me unmute. Hi, everybody. Kim Johnson from Bananas, and want to talk to you about supplies. All the work that you guys are doing, we are so appreciative of it, but we know there is a heightened need for supplies. We want to help you to get that. So next slide. What I'm going to do is a brief update on what we've done to date and then what's going to be happening in the future. We had two really big distribution of supplies. The first one happened in May. It was for open providers. We received funding, we being all three resource and referral agencies, received funding from First 5 Alameda, a very generous donation, and it allowed us to give that first, the first level of supplies for providers. So that went out in May for open providers. And then, as has been mentioned throughout the presentation, California Department of Education came out with a fund statewide. Statewide, it was $50 million. What landed in Alameda County was about $2.1 million that we got, all three of us combined. And so we had a first round of applications that went out in early May. It was the eligible providers that could participate were those providers that were open or said they would be open by June 1st. And if they got their applications in by the 15th, you should have started to receive payments the end of May through this week, actually. So if you have not received your stipend by the end of next week, please call one of us, Bananas, 4Cs, Hively, whoever you are connected with, and we'll make sure that that gets out. And so, as was mentioned earlier, we try to do everything in a very coordinated way, have the same messaging so that it wasn't confusing to everyone, or to anyone, I should say. So we had decided for that first round of supplies that we would do it in the form of monetary stipends. And we would also be doing it with supplies subsequent to that first round of monetary stipends. So the first round went out, as I mentioned, the end of May through this week. The checks should have been received, and I use the word checks with air quotes because most of it went through an ACH automatically deposited into your account. And then also, outside of those two major distribution events, there have been ad hoc distributions as we were able. That's based on our availability of supplies and requested by providers. So from time to time, a provider might call in a really distressed situation, and if one of the RNRs had supplies on hand or were able to get them to them, they would then provide those supplies. But the first two events I mentioned were really large supply distributions with supporting hundreds of suppliers. So as you know, that was a lot of money that the state provided us. So we still have additional funds. We are doing a true up to see what's left. And we're going to be doing a second round of applications. Look for those sometime in the middle of July. And you'll have an opportunity to apply for, again, stipends and supplies. In the interim, Hively has a distribution coming out July 27th. And Bananas will be distributing, actually shipping supplies June 29th, 30th, and July 1st. Those registration is required. And you would have gotten something from either one of our organizations. I got a copy of the email that went out about 30 minutes before this webinar started from my colleagues at Bananas. So the people who would have gotten that email, we mentioned to you about applications for all 3 RNRs were accepted through May 15th for that first round, but we were still collecting your request. So anyone that has requested up until today actually will be notified about upcoming supplies. And at the end of the presentation, there is contact information so that if you haven't received information or you want to hear more about what available supplies or how to get them from us, you can contact us. So as I mentioned, the second round of applications will be introduced in mid-July. And you know, none of us want to be in the business of warehousing or stockpiling supplies. So as we get them, we will distribute them. As long as we have funding and as long as we can acquire supplies. We have a little bit more buying power than you as an individual. We don't have as much buying power as Target. So we're somewhere in between. And you know, each of us, when we get some money, we work with different various vendors to get supplies that you need. And that ranges everything from, you know, just the wipes to having the scannable thermometers and everything in between. So we're hard at work trying to get that done. And I think that's all I have on supplies. And I think the next slide is our contact information. So if you haven't, or you have more information, or you haven't been contacted, or you want to know how you can get supplies, you can reach us at those email addresses and someone will get back with you. That's all I have.
Hey, thanks so much, Kim, for that. I'm going to hand it over to Angela Cabrera right now on our team for a quick overview of a website she's developed to centralize all our county guidelines. And Angela, why don't you describe a little bit more?
Gracias, Helen. Thank you. Buenas noches. So I'm going to make it really short and sweet because we don't have enough time, but I want to make sure that you know that this resource exists and it came based on the needs that you share with us during the listening sessions and the different opportunities that we were able to share with you. So it's one place where you're going to find resources that will help you, hopefully help you with your efforts to open up again your childcare program. So you're going to have resources for around human resources, how to manage your program, how to share information with your employers, information about business development in the fiscal part. We know that that's one of the more challenging informations to understand because the business portion, it's sometimes very complex. On the programmatic area, we have a lot of different resources regarding social emotional supports, how you can support your families and children coping with trauma, with all the stress of this pandemic, additional resources around professional development. I want to highlight a couple of resources here in addition to the trainings that the resource and referral agencies are putting together virtually. We also have access to a wonderful state website that is the California Early Childhood Online, CICO, that you, I hope most of you are already familiar with it. they had a module on health and safety, highly recommended, that you can share with your staff. You can watch it together with them and go over the recommendations they have around health and safety. And the last piece on this page is a link to the federal, state, and local guidance. And on the bottom, we have the Alameda County Public Health Department, the page that we mentioned earlier, that it was going to take you directly to all the different tip sheets and FAQs that the health department is putting together that really impacts childcare. And the last piece that I want to share with you, making sure that you visit on the top right corner of the website is best practices. And in this section, we have shared with you templates, checklists that some of your colleagues have developed. They've been using it, and it's a wonderful resource for you to tap in. You can download it and personalize based on your needs, on your program information. And I also want to open this opportunity for you to, if you already developed a document that you find it very helpful and you are willing to share with the rest of the community, please contact us, send us that document that we will be very happy to share with the rest of the community. These resources are updated constantly. We have tip sheets around wearing a mask for children and a social story that is fun for them, is educating for them, and the transition tips for reopening infant and toddler programs. So thank you, and I hope you enjoy this resource, and please share with us any feedback you have around it. If you see a resource that is not there, that you find, that you think is very important and determinant in how you can reopen your program, please let us know.
Great, thank you so much, Angela. So in the last couple minutes, we're just gonna show you some overviews and links to resources to help you manage your programs during this time. We thank you so much for joining us. Here's our community care licensing website. The next screen, I'll show the county ECE program website, which has enrollment forms for our mental health consultation program, as well as the public health nursing program to support your programs. And Angela's website, she just profiled the Reopening Stronger provider website. And the next slide shows some resources that Lisa has referenced, including a tip sheet for families returning to childcare and camps. And we ask you to fill out a pop-up at the end of this webinar that'll open in your browser, which has you fill out an evaluation, and your responses will help us develop future resources for you. We'll be sending this presentation to you. We'll be developing a Q&A based on the questions we could not get to tonight. And we look forward to being ongoing partners with you in this work. And thank you again for all you're doing. And with that, I think we'll call it a night. We also appreciate our partners who joined us this evening to share their knowledge. Good night.